I spent 75 days in a recliner. All I wanted to do was get fresh air.
A new treatment puts a cancer patient on the road to recovery. That's next on Health Talk.
Live from KDLY TV 11, this is Health Talk with Robin Hubner. Health Talk is brought to you in part by MeritCare Health System.
Good evening and welcome to Health Talk. What if cancer patients could reduce the amount of time spent on difficult treatments? Well, they may be able to with something called high-dose rate brachytherapy. Tonight on Health Talk, how does this new twist on an age-old treatment work? Which cancer patients might be candidates for it? And how can it shorten treatment time with fewer side effects? Well, brachytherapy helped a Perham, Minnesota man battle cancer of the esophagus. And because of it, he's now living out a lifetime dream.
About 500.
Tom Kolb is just back from a long weekend.
I found a whole bunch of back roads between here and Huron. None of them that had a curve on them either.
A trip on a vintage motorcycle he picked up as a present to himself for surviving cancer treatment last summer.
But the source is inside the machine, so the source is never inside the patient once she leaves the room.
Tom had high-dose rate brachytherapy delivered through a system similar to this. Doctors could aggressively target Tom's tumor without damaging his heart and lungs.
External radiation couldn't get a strong enough dose to do much damage to the tumor, and it was inoperable the way it was because of the size of the tumor. So that's why they went with the brachytherapy, with the high-dose radiation. And that actually took the tumor from as big as 2 tennis balls to some chunks about as big as my thumbnails.
So a little more than a year after his diagnosis, Tom is doing well and able to pursue his motorcycle passion.
And I've always wanted that particular old BMW. They only made 240 of those. And I finally found one on the internet, went and bought it. And now my goal is just ride the wheels off it.
It was a very tough road for Tom, though. After the brachytherapy, Tom also had external radiation, chemotherapy, and surgery to remove the tumor. Through it all, he lost about 120 pounds. He's getting checkups every 6 months now, and at his most recent one, doctors told him he is cancer-free. Up next, MeritCare radiation oncologist Dr. Nicolas Zouain will be here in the studio to talk about high-dose rate brachytherapy. If you have a question for him, call us at 237-5212 or on our toll-free line, it's 1-800-450-5844. We'll be back with your questions next on Health Talk.
MeritCare saved my life.
Roger Maris Cancer Center saved my life.
MeritCare Heart Center saved my life.
For 100 years, the people of MeritCare have focused all their skill, all their experience, and all their compassion on one thing: improving the quality of life. Today, we continue our commitment by lighting the way to better health care. MeritCare, celebrating a century of caring.
MeritCare Children's Hospital.
Welcome back to Health Talk. Tonight we're going to be talking about advancements in radiation treatment for cancer. It's called high-dose rate brachytherapy. And you can call us with questions about it. The numbers are 237-5212 or 1-800-450-5844. And here to provide some answers now is MeritCare radiation oncologist Dr. Nicolas Zouain. Thanks for being here tonight.
Thank you for having me.
Let's talk about brachytherapy. This treatment is actually, it's relatively new the way it's done, but it's actually been around for a while.
Yeah, it has been around for around, like, I would say 80 or 90 years. It started mostly in Europe, in France. So Marie Curie, the famous, she got Nobel Prize for that. She started treating cancer patients using source of radiation like radium. So they had some success, but they didn't use it kind of safely initially. And then later on in the last few years, we had kind of new sources of radiation that we call high-dose rate brachytherapy. Those sources of radiation are very active, and that brought a huge improvement to the treatment of cancer patients with brachytherapy.
So what's the goal here in the way this treatment is delivered? You're trying to kill the cancer, but not do much to the surrounding organs and tissues. How does brachytherapy accomplish that?
Yeah, there is two types of radiation. So there is what we call the external radiation. That's done with a machine of radiation that give a radiation to a patient probably like from a yard far away. While brachytherapy, to treat the cancer, we're using a source of radiation. The advantage of using a source of radiation is that the amount of radiation that will travel is small. So the advantage of brachytherapy is to give a very high dose of radiation to a very small area and to protect the normal surrounding tissue, because we are going to put the source of radiation inside the tumor. So while on the other hand, the external radiation, the radiation has to cross the skin and the body of the patient to get to the tumor, so it has to go through normal tissue.
Okay, now the patient that we featured just a little bit ago, Tom Kolb, with cancer of the esophagus, is that a typical type of cancer that would work with brachytherapy would work on?
Usually esophageal cancer is treated with radiation, external radiation, and chemotherapy. Then we go for surgery later on.
I see.
But sometimes, like the case we presented, the tumor is way too large and it's impossible to remove it surgically. And giving radiation, external radiation and chemotherapy alone wouldn't be able to shrink the tumor enough so that the surgeon can remove it. So adding brachytherapy, it was kind of, they started doing on a research protocol. They found by adding brachytherapy, we can increase the dose of radiation to the tumor safely and with protecting the normal tissue, and to be able to shrink the tumor to a minimum. So we can have a tumor that initially is around like 3 or 4 inch that is not removable surgically. With brachytherapy and radiation, external radiation, and chemotherapy, we are able sometimes to make the tumor almost vanish and go away completely, so the surgeon can do a good job and remove the tumor.
What other types of cancer might this apply for?
We can use it for breast cancer, especially in Fargo area. We have a lot of regional women that we have to treat. So sometimes the treating with radiation is around 5 to 6 weeks of treatment. So for early stage breast cancer, we can use brachytherapy alone and treat over only 5 days. So that will save a lot of trips, because a lot of women live 200-300 miles away from Fargo Moorhead area. So,
sure.
So that's a very good thing, save on the trip. And also we use it for prostate cancer. We can use it as treatment alone, or sometimes with combination with external radiation. We can also use it for cervical cancer, endometrial cancer, different type of sarcoma, rectal cancer, biliary cancer, for the bile duct. So it has different applications.
Quite a few, it sounds like.
Yeah, and also lung cancer.
Lung cancer as well. All right. We have a number of callers waiting to ask you a question tonight, so let's go to the phones. Caller, you're our first caller on Health Talk. What is your question for Dr. Zouain this evening?
Hi. My mother was diagnosed with throat cancer 6 years ago, and she underwent radiation and a little bit of chemo, but now we're finding she has a lot of secretion, and to the point where she's up at night and coughing to try and get this out. Is there anything that might help her?
Initially, you can have what we call long-term side effect of the radiation, but, the first thing you want to make sure is that she needs to be followed, that, no cancer came back. So usually we do different type of testing, like CAT scan, MRI, and physical examination to make sure that the cancer did not come back and that is not inducing the secretion. Also, we want to rule out any infections that is taking place there. But usually different things that we use for, too much secretion, usually I ask the patient to have, a humidifier at home when they sleep, because especially during the winter time or even summertime, if they breathe like air that, contain dust, like regular air, they have more secretions. Also, sometimes we ask them to gargle with to put water with baking soda and salt to gargle with that to get the secretion out, because sometimes when they have too much secretion that they are stuck, they can have, infections.
Okay. All right. Thank you, caller. Let's go to the next caller. You're on Health Talk. What's your question for Dr. Zouain this evening? Hi, caller. Caller, go ahead.
Oh, hello?
You are on. Go ahead.
Yes, I was wondering if I have Hodgkin's, and I want to know if this treatment is something they can use for that type of Hodgkin's lymphoma.
No, for Hodgkin lymphoma, usually we don't use the brachytherapy for one reason, that when somebody has Hodgkin lymphoma, the cancer cell can move around in the lymph node, and we want to treat with kind of a security margin around the lymph node that has cancer. Brachytherapy gives a kind of a pinpointed dose of radiation to a small area. So in Hodgkin, it's not usually indicated because you want to treat kind of a larger area. So we usually use chemotherapy and external radiation.
Okay, needs to be a localized area then for the brachytherapy. Okay. Next caller, go ahead. What is your question for Dr. Zouain this evening?
Well, I have lupus, okay, and the cells attack themselves. I go in and out of remission, you know, and I'm wondering if any type of, you know, something like that would help. Would it be possible to try it? Because lupus is a terminal illness. You know, I have to live with it for the rest of my life. But I'd like an answer on that. I don't know.
No,
is there any application for? Thank you, caller, for that.
Usually, we don't use radiation for lupus. Actually, sometimes, unfortunately, radiation can make lupus worse. So if somebody, unfortunately, has lupus and they have cancer, usually we try to avoid, especially if the lupus is active, we try to avoid radiation because that can make the lupus worse.
So if somebody has cancer and lupus, what would be a course of treatment for that cancer?
It depends on the type of cancer. We try to use chemotherapy or surgery, but we try to avoid the radiation. Sometimes we have no choice. We have to, you know, accept the side effect of the radiation and go ahead if there is no way around that. But we try to avoid it usually.
Okay. We have to take a break. We'll be back with more of your calls right after this. We're back with Health Talk. Our topic is brachytherapy. That's high-dose radiation for certain types of cancer. This is Dr. Nicolas Zouain from MeritCare, and he's taking your questions, and we do have a couple of folks waiting, so we will go to them. Caller, what's your question for Dr. Zouain this evening?
I have a relative that has stomach cancer, and they went in, gave him chemotherapy, then they went in and was going to remove his stomach, and they found that he has cancer in the abdominal area. Is this internal radiation something that would help him?
No, since it seems that, you know, the cancer is spread out in more than one area, we cannot usually use brachytherapy for that. Usually brachytherapy, in general, we don't use it for stomach cancer, even if it's localized. So it's not tested. We didn't do any research on that, so we don't use it for stomach cancer.
Okay, caller, thank you for that. Let's go to our next caller. Go ahead. You're on Health Talk. What's your question tonight?
I have a question about colon cancer. Can this therapy be used for colon cancer as well?
So usually for colon cancer, we don't use it except for rectal cancer, which is, you know, the last part of the colon. We can use it in certain situations, but not for colon cancer.
Do you think at some point brachytherapy will be available in some of these other treatments, or is that just something, it's the nature of the cancer itself that it won't be applicable for that?
No, it's not really the nature of the cancer, it's how to get the source safely to the organ you want to treat. So if it's a deep organ, we want applicators that we can put safely inside that tumor to treat it. So stomach cancer, for example, and colon cancer, we don't have those applicators yet to do that. So because usually we don't put the source directly inside the tumor. What we do, we put kind of a plastic applicators inside the tumor if it's a prostate or breast or any type of accessible tumor, and then the patient will go to the room. During the treatment is like 5 to 10 minutes, and then when the patient by himself or herself in the room, the source of radiation will go inside the applicator. It's controlled by a computer system to treat the tumor. So we need also to develop more applicators to treat more type of cancer.
Can you talk about what the patient experiences in comparison, brachytherapy compared to radiation therapy, in terms of what they feel like when they're going through the procedure itself, and then after any side effects that follow after? Compare the two if you would.
Yeah, the external radiation is a non-invasive technique. It's like having X-ray. So the patient laying down on a table, it's non-invasive, and there's a machine that's giving radiation. Brachytherapy is more invasive, but usually it's minimally invasive, so we don't need major surgery to do it. But usually we need to get those applicators inside the tumor. Let's say if it's a prostate cancer, we bring the patient to the operating room, and under spinal anesthesia, we're going to put, 15, 20 catheters inside the prostate. And then the patient usually will undergo a CAT scan that prepare for the brachytherapy. And then the patient will wait for, a couple of hours while we're doing the treatment plan. And then at the end, we do the treatments that take like 15 minutes. So usually the patient will spend 2-3 hours in the hospital, but it's usually done as outpatient, so the patient will go home same day. External radiation is usually only 10 minutes per day, and the patient will go home right away after that. The side effect of the radiation and external radiation are a little bit identical because they depend exactly where we give the radiation. Meaning, let's say if we're treating a man with a prostate cancer, since next to the prostate we have the rectum and bladder, so by giving external radiation to the prostate, we irritate those two organs because the radiation has to cross those normal organs to get to the prostate. Brachytherapy carries side effect like, putting the implant in, but the patient usually will have painkiller, will be under spinal anesthesia, so usually they shouldn't feel too much pain. And then the treatment is not painful, and the side effects usually are less than external radiation because the radiation is limited to the organ. So the fall off of the dose is really fast, meaning if we are a little bit away from the source of radiation, the amount of radiation that is reaching the normal organ is very, very tiny. So the side effects are very limited.
Very limited. All right. We will go back to the phones. I would like to remind our viewers when you are up and we go to you, if you would make sure to turn your television down just while your question is being asked, and then you can turn it back up to hear the answer. So next caller, go ahead. You are on Health Talk. What's your question this evening?
Is that me?
That is you, sir. Go ahead.
Okay. In 2001, I was diagnosed with clear cell carcinoma of the kidney. They took the kidney out, and the doctors at Roger Maris said it would be back 8 to 16 months. I went through 2 sessions of treatment in Milwaukee in a study where they did infusions. If this does come back, is this some kind of a treatment that would help me?
Yeah, hopefully it will not come back, and you don't have to go any more treatments. But if it comes back, it really depends where it came back. And then a different option could be considered at that time. Sometimes we use systemic treatment like chemotherapy or some different type of immune therapy. Sometimes we have to use the radiation because some organs, the chemotherapy cannot reach them safely or not with amount dosage. Let's say if the cancer comes back in the bones, and sometimes we use external radiation instead of chemo or a combination of both. So it really depends where it comes back, but hopefully it will never come back and you don't have to undergo any treatment.
All right, caller, thank you for that. Good luck to you. And we're going to take one more break here, and we'll be back with more after this. Back with our final segment of Health Talk on brachytherapy. And Dr. Zouain, you and I had spoke earlier. You said that there is a palliative aspect to brachytherapy as well. You want to explain that?
Yes, sometimes we use brachytherapy not to cure somebody from cancer, but if the cancer is metastatic and it's not curable, but there is symptoms that are induced by the cancer that could be palliated and mean to induce more comfort and better quality of life for the patient. Let's say if we have a tumor that is almost blocking a esophageal tumor, or the patient not able to swallow well, or a tumor in the lungs that's almost blocking the airway, that want to keep it open so the patient can breathe better, or sometimes perhaps endometrial tumors, or a cancer of the uterus that is bleeding, that we want to try to stop the bleeding. So sometimes we use brachytherapy as a way to palliate the pain and to induce better comfort for the patient.
Okay. We have sort of a, not related to palliative, but mentioning uterine cancer. Our next caller wants to ask about that. Caller, what's your question for the doctor tonight? Go ahead, caller.
Yes, I have uterine cancer, and it is also metastasized into a hip joint, and I was wondering if this would be a therapy that could be used for that.
I think probably you underwent surgery. I'm not sure about that, but It depends on the site where it's metastasized, but usually we use more chemotherapy to palliate and sometimes more external radiation. But if a woman did not undergo surgery and the tumor is still in the uterus, and that tumor is inducing some problems, then we can use brachytherapy as a way to palliate and to kind of shrink that tumor for better comfort.
Okay, all right. Doctor, you mentioned that at some point down the road that there may be other applications for this. Do you want to talk about where this treatment may be going? And also, one other question I had for you, are there any clinical trials set up for this at all, or not? Is this, I mean, this is an established treatment, so I guess you don't, nothing's being trialed, but.
Yeah, it is an established treatment, but at the same time, there is a lot of trial going on to see which dose to use, when to use it exactly, how to combine it with different treatment. So actually, there's a lot of trial going on to use brachytherapy as a solo treatment or in combination with different treatments. So, well, still, definitely there is a learning curve. You know, research in medicine never stops. So we are, you know, many institutions, you know, around the country are doing more research to see which dose, how to combine this treatment and to add it to different modality to fight cancer.
How does this compare success rate-wise with just the straight external radiation, or can you talk about that?
It depends. Let's say for early stage breast cancer, it's equivalent. So if you use brachytherapy over 5 days or 5-6 weeks, it's equivalent. So in that setting, it's equivalent. In different type of cancer, let's say prostate cancer, sometimes it's equivalent for low-risk prostate cancer. But for high-risk and intermediate-risk prostate cancer, which are cancer a little bit more advanced, usually we combine both. So the brachytherapy is here to kind of help the external radiation and to increase the dose of radiation to the tumor. So that would be the job, kind of a boost of radiation to the tumor.
One more tool for you to help patients out there. Doctor, thank you very much for your time today and your expertise, and thanks to the callers for their calls. If you would like some more information about brachytherapy, you can call MeritCare Roger Maris Cancer Center. That number is 234-6292. You can also get more information by going online to healthtalk.meritcare.com. That's going to do it for Health Talk. See you next time.